ES Audio.
From the Evening Standard in London, I'm Rochelle Travers, and this is The Leader. What's happening to our NHS?
Well, I've been an A&E doctor for 17 years and I have never seen it so bad for staff and for patients. We're having to perform intimate examinations, for example, on people who are coming in worried they might have bowel cancer in cupboards. Patients are sleeping on floors while nurses are trying to hold up sheets so that they can be examined.
Shadow Health Minister and practising doctor Rosanna Allen-Khan speaking on BBC Breakfast there about the current pressures faced by the NHS. It comes as it's revealed ambulance crews in London lost the equivalent of 3.5 months because of handover delays, with 7,000 Londoners waiting more than 12 hours to be admitted to A&E, a rise of 46%. This follows a big reaction to guidance announced which, amongst other things, suggests the idea of reintroducing face masks to take the pressure off health services. Daniel Keane is the Evening Standard's health reporter.
Well, it's in a very grave crisis by pretty much every metric. In terms of the figures, we're seeing record waits for ambulances, we're seeing record waits for treatment in A&E, and we've got a record backlog in care, about 1 million Londoners now waiting for routine operations. So yeah, by pretty much every available metric, we're looking at the worst crisis we've ever seen. Talking to people on the front line and medical experts, and they will tell you the same thing. We're now in a situation where these figures are translating, sadly, into deaths and into patients deteriorating while waiting for emergency care. So I think what's different now is we have pressure across the system. So there isn't any sector of the NHS, whether it's primary care, secondary care, that isn't really, really struggling. And I think the pinch points particularly are in A&E and ambulances. And I think on those two metrics, we've never really seen anything like this before. We've never seen thousands of people in London waiting more than 12 hours to be treated in A&E, people waiting up to 2 hours for an ambulance to arrive. As bad as the NHS crisis has been in previous years, I think most people working in it will tell you there's never quite been anything like this. And of course, on top of that, we've got unprecedented industrial action by nurses and ambulance workers, and that's not happened in the past. So I think there are a lot of signs that this is considerably worse than it has been. In terms of the public, I think, of course, people should be concerned, but the NHS are sort of at pains to stress that it doesn't mean people shouldn't engage with emergency services. If you're ill, obviously, continue to attend A&E if you think you're seriously ill. But on a sort of deeper level, these issues will need to be addressed urgently by politicians, because the public will start to see the effects of this when they go to hospital or when they need care from the NHS.
Prime Minister Rishi Sunak has been speaking about the struggles faced by the NHS. What's he been saying?
Absolutely. So the Prime Minister acknowledged in his speech today that there's a problem in A&E.
I know there are challenges in A&E. People are understandably anxious when they see ambulances queuing outside hospitals. You should know we're taking urgent action, increasing bed capacity by 7,000 more hospital beds and more people cared at home.
It's a very slight change of messaging from a couple of days ago, or even a day ago, when his spokesperson said that there was no crisis in the NHS. I think they're probably hesitant to use the word crisis, as obviously it would have an effect on the public, but also there's a careful sort of management that they have to do of the narrative here, because if they start to use the word crisis and they start to kind of talk up how bad things are, then there's a risk that the public could pin the blame on them for this crisis. Obviously, they have been in charge of the NHS for 12 years, so that makes that criticism slightly sharper. It's not just an organisation they've taken over in the past 2 years. So some of the structural failures, that narrative cuts through to the public, could really harm them politically. And so that's why you've seen Sunak and you've seen Health Secretary Steve Barclay also say that these pressures are down to the pandemic and flu, because they don't quite want to admit publicly that there are deeper structural issues they have to fix.
And face masks are making headlines again. Just explain why and who is suggesting that they make a comeback.
Yes. So Professor Susan Hopkins, who's the Chief Medical Advisor at the UK Health Security Agency, has urged anybody who's feeling unwell not to visit vulnerable people and to stay at home and to wear face coverings when outside, which is a real sort of throwback for many people to the days of the COVID pandemic. And I think that the reason they're issuing this advice is that we have a huge sort of convergence of different seasonal viral illnesses happening at the same time. We've got a really bad flu season. So the latest figures show that 310 flu patients were in hospital in London on Christmas Eve. Considering that it was just 28 on November 20th, that's a very big rise. And COVID cases are starting to rise as well. So I think it kind of goes back to what we were saying earlier. Given that hospitals and A&Es are under such severe pressure, this is just a very small measure that the public can take to try to reduce the spread of these illnesses and try to reduce the pressure on the NHS. Whether that kind of public messaging will cut through to people who understandably might be slightly wary of adopting these measures again after sort of 2 years of the pandemic is a different question. So we'll see whether that messaging cuts through.
And finally, what next? How long has the government got to address these issues in the NHS?
I think there's a lot of variables in terms of whether the situation will get worse. Two of those are obviously flu and COVID. We don't know how much worse they're going to get. We're not precisely sure where we're at in terms of the spread of both. So the government will be monitoring that carefully. In terms of what they're doing, Steve Barclay has pointed to the £200 million of funding that has been given to increase capacity in the social care system. And that ideally will help patients who are medically fit to be discharged from hospital to get out of hospital and into social care. However, we don't know, firstly, whether that money will have an effect in time and whether it will be sufficient to allow kind of trust leaders to really ease pressure on the front line. I think in terms of a forecast, the best that I've had is from Ananda Siva, who's the chief analyst at the King's Fund. And he told me yesterday that the best case scenario is to actually hold steady at the current level. But the real risk in the long term, or even in the medium term, in the next 18 months, is that very poor performance in the NHS becomes a kind of new normal. And the government really will find that quite tricky to defend at an election when Labour is pointing at the worst NHS statistics on record. So I think given that the NHS needs huge structural change, it needs funding, it needs a workforce strategy, it needs a social care reform, the Conservatives might shy away from doing that in the next 18 months. They simply don't have the time. And I don't know personally if they have the will to embark on radical NHS reform, but it's certainly an area that Labour will be looking to target at the next election.
Let's go to the ads. Stay there to hear from Professor Azeem Majeed from Imperial College London about what can be done to save the NHS. Welcome back. Professor Azeem Majeed is head of the Department of Primary Care and Public Health at Imperial College London. He's also a GP and consultant in public health and works in the NHS.
The current situation is probably the worst I've seen in many, many years, certainly probably my professional lifetime, which goes back around 30 years or so. I think the current period we're seeing over the last few weeks and into January is the toughest I've seen, I think, particularly for acute care, people with medical emergencies. So we're facing a number of challenges. So one is we're seeing a very large increase of people with acute infections, things like flu, COVID, RSV, and so on, which is putting a lot of strain on the NHS. We've also seen an increase in streptococcal A infections as well in recent weeks, again, which has put strain across the NHS. So we're seeing acute problems, which are then compounded by long-term problems like a lack of acute beds and a lack of social care provision and long waiting times for people to be seen by specialists.
What would you like to see the government do to help improve the current situation?
So I think we need a mixture of very short-term solutions plus longer-term solutions. So in the very short term, there are some things that could be done to help the NHS. For example, trying to reduce the admin burden on the NHS, reduce, for example, secrecy inspections, perhaps suspend those for now, reduce the time spent on things like appraisal of staff. I think in the medium term, we need to look at trying to free up more acute beds in hospitals by perhaps creating some intermediate care beds, so beds where people can go to while they're waiting for a permanent place to be discharged to free up hospital beds for people who are acutely unwell. I think that would probably help as well. And we need to improve social care as well. That's going to take much, much longer to address and deal with. And we need to also address workforce shortages. We need to look at things like how we recruit staff, how we retain staff in the NHS, GPs and other staff, for example.
It seems like the NHS being in crisis has been discussed for a long time. How concerned should we be for its future now?
I think people should be concerned. The NHS does face long-term challenges. As you said, it's been in crisis for a long time, but we are now seeing very acute pressures on the NHS, from infections and other problems. And we are seeing people, with problems like stroke, for example, heart attacks, not being dealt with promptly by the NHS, and that leading to people dying, perhaps when they shouldn't be dying. Yes, I think people should be concerned because I think when people can't be assessed quickly for major medical problems, that's a sign that things are very, very bad, and we do need urgent action to address those problems.
And that's it from The Leader. This podcast is back tomorrow at 4 p.m.